reality TV, where today we will be deeply diving into Dr. Schaffer's death from the 1971 film The Hospital. I have a few of my analysts from FAMU Hospital, and we are going to dive deeply into why Dr. Schaffer was found dead. Go. Did y'all hear what happened with Dr. Schaffer's death?
No, I didn't know that.
I heard he was doing something inappropriate.
Really? I would like to know what happened.
Well, they have a clue of what happened right here.
She did that right now. I'm so terribly sorry.
As I understand it, one of the nurses inadvertently administered an IV to Schaffer here. How the hell could that happen?
I think we ought to straighten this out somewhere else. Yes, very good idea. Oh, God, what a mess. Well, these things happen, of course.
I suppose I'd better call the medical examiner.
I still don't understand what happened.
Well, it took us about an hour to get it sorted out. It seems a patient named Guernsey died last night at 8:06, but that information wasn't given to the night nurses. These things happen. At any rate, according to the Cardex, the patient Guernsey was down for 25 milligrams of Spain at Q6H, and Mrs. Reardon sent Nurse Perez to give him his 12 o'clock shot. In the meantime, it seems Dr. Schaffer used that particular bit for his own purposes. Dr. Brubaker suggests it was for a love tryst, and some weight is given that hypothesis by the fact that Dr. Schaffer was naked.
I got the drift, Miss Christie. In other words, Nurse Perez went in and sedated Dr. Schaffer thinking he was the patient Guernsey. My God, what I don't understand.
May I finish, please, Doctor? After Perez gave him his shot, she noticed the IV was pinched off on the bed. So she reported this back to Mrs. Reardon, who then assigned Nurse Rivers to restart the IV. Now, Rivers was a flunk. She didn't even know the staff people on the floor. Nobody knew what the patient Guernsey looked like anyway, since he'd only been admitted that morning.
So she plugged an IV.
Yes,
How much?
a liter.
5% glucose solution won't kill anybody.
The root cause analysis is a structured process for identifying the underlying factors that cause an adverse event and has been used in industries for many years. We will be conducting a root cause analysis to further explain Dr. Schaffer's death, utilizing the three tools: the cause and effect diagram, fishbone diagram, and the flowchart.
The root cause analysis is comprised of many steps. The first step is to really understand what happened during the steps before Dr. Schaffer's death. So now, this is what we're going to do with you all today to break it down. So, the client who was supposed to be in the correct bed was admitted to the hospital. The client was then given a diagnosis prior to his arrival to the hospital. Dr. Schaffer did not follow up with the diagnosis. Due to this misdiagnosis and failure to assess the client, he was given the wrong medicine. Client died because of wrong medicine given for his misdiagnosis. A bed became available due to the death of this specific client. Dr. Schaffer contacted his nurse friend, whom he was in sexual relationships with, and informed her there was an open bed. Dr. Schaffer did not submit the proper paperwork to the next shift that the patient had passed and the bed was available. And his nurse friend had sex in the open bed. Dr. Schaffer then fell asleep in that bed. Due to the lack of information and not following proper protocols, Dr. Schaffer was given the medicine that the deceased patient was supposed to receive. All of these actions and miscommunications and not following protocol led to the untimely death of Dr. Schaffer.
Good afternoon. Today we'll be discussing Dr. Schaffer's death through a fishbone diagram. There are a number of factors that led to Dr. Schaffer's death. Policies, procedures, staffing, as well as decision-making played a part in the death of Dr. Schaffer. Policies: there was no confirmation of the patients administering medications. There was ineffective communication between nurses and patients. Staffing: there are over 1,000 nurses in the hospital, and there was Dr. Schaffer's death, which wasn't supposed to happen. There were complaints of inconsistency in the nursing staff as well. When it came to decision making, better personal management would have been a huge factor in keeping Dr. Schaffer alive, as well as Dr. Schaffer's own decision making by him laying in the bed when he wasn't supposed to be and eventually dying. The procedures, Dr. Schaffer failed to submit proper paperwork to inform the next shift of the patient's death, and this was because he wanted to use the bed for his own personal use. Nightly rounds were not conducted to ensure patient safety, and patients went hours without being seen. In result, Dr. Schaffer's death.
To analyze Dr. Schaffer's death, we brainstormed a cause and effect diagram to show in which the incidents occurred. A cause and effect diagram is usually used to tell what happened. The first cause is they didn't relay the information to the night nurse about the patient in bed 806 dying, so the effect of that was able to inject Dr. Schaffer with the incorrect medication. The second incident that happened, Dr. Schaffer and the nurse friend was having sexual relations. In turn, that allowed him to be able to fall asleep in the bed. The third incident that happened, nightly rounds weren't completed, which Dr. Schaffer died in his sleep. Night nurse did not check to see if the patient who she was seeing was correct, so in turn, Dr. Schaffer was given the wrong medication. The inconsistent nursing staff was the effect of everyone not correctly being up to date on policies and procedures.
Our first recommendation would be to implement an HR training to help employees define and understand exactly what appropriate employee relationships should be. Our second recommendation would be to keep accurate documentation of patient information, which means the nurses, doctors, and any other healthcare professionals should be able to document exactly what it is that they talked to the patient about, what they did to the patient, what medications they gave to the patient, and other things patient related in those documents. Our third recommendation would be to have updates between shifts, which basically means night nurses and day nurses need to definitely have a conversation about their patients that they have in common, whether it's about the patient's status, the patient's plan of care, any changes that needs to be discussed. Then we suggested that we have hourly rounds on each and every patient. Nurses need to round on their patients every hour to make sure the patients aren't dead, the patients aren't degressing in health, and any other things they need to check during those times. Then we want you all to have constant updates on charts. Anybody who has seen their patient needs to document in the charts to keep an updated patient plan of care. Then the last recommendation would be nurses should be able to be accessed and keep abreast on all patient information. There should be no reason that nurses should not be found. If you cannot find a nurse, a conversation needs to be had by the manager because they should be available at all times.
Since we have identified the root causes of the sentinel event, we're using the phrase risk reduction strategies. We implement these strategies and test to determine whether desired results have been achieved. If strategies are successful, then they are made permanent. Strategies that aren't successful determine why they didn't work. Above are risk reduction strategies that we would want to implement because of Dr. Schaffer's death. One risk reduction strategy is helping people identify and correct mistakes before the patient is harmed. Ways in which you can do that is verify patients' identification before administering medications, things such as their name or their date of birth. Another one is assessing the environment, making sure to read the charts, paying attention to details, and looking at plans of care. Another risk reduction strategy is helping people perform their jobs correctly. Ways in which you create charts about checking and double checking patients' information, as well as standardize the intake process and the patient's death process, reducing unnecessary steps, and educating and training staff and monitoring compliance.
On behalf of Quality TV and the wonderful staff here, we thank you for tuning in, and we hope that you learned something from today's program.